Welcome, thank you for joining. I'm Rob Warlick, the Director of Brand and Marketing here at PEAKE Technology Partners. And I am privileged today to interview Elisabeth Happel, who is one of our cyber security specialists here at PEAKE. And we're joined also with Mary Knotts, who is our Chief Operating Officer, CISSP, and one of the partners here at PEAKE. Welcome to the both of you. Thank you.
Thank you.
Looking forward to the conversation today. We're excited to just take a few minutes here to introduce to you our new security risk assessment product and discuss what that means for medical practices like yours and how you can take advantage of it here at PEAKE. If you're not aware, PEAKE Technology Partners, the reason why we exist is to help medical practices leverage technology as a tool to help you grow your practice and care for more patients. We'd love to help you be a part of that. How do we do that? We have a robust service offering that includes managed IT services. We have our own proprietary phone solution called PEAKE Voice. We're very excited about that. And our focus here today is our third kind of category of services. That's our data security, or more specifically, our security risk assessment offering. And so Mary, I'd like to start with you. Before we dive into the details of PEAKE's Healthcare Security Risk Assessment, our new offering, I'd like to hear from you and maybe share with the audience why a security risk assessment is something that they should be paying attention to.
Sure. Well, there certainly is the aspect of compliance with HIPAA regulations. Additionally, cyber insurance companies are now applying a greater level of scrutiny to security practices. And they are requiring that specific controls be applied within the organization, or they won't provide insurance or coverage, or the rates are exorbitantly high. But more importantly, though, it's the real threat of compromise and what that can cost a practice. It's important to be aware of where your organization's vulnerabilities are and to be able to make informed business decisions based on that information and to know where to apply resources. But the first step in that is awareness. And in cyber defense, it's really understanding your threats and your vulnerabilities.
So what I'm hearing you say is a security risk assessment helps practices with awareness. Where is the threat coming from? And that's really their first step in cybersecurity defense.
100%.
Okay. So Elisabeth, I'd like for you to jump in here, and for our audience of practice managers, of healthcare leaders, what is happening in cybersecurity space, specifically in the healthcare industry? What are things they need to be aware is happening?
Right, so it's a lot. There is a lot going on. There have been for the last couple of years. So we see that in 2020, about 34 million patients were affected by a cybersecurity attack. And in 2021, that number jumped 32% to about 45 million patients that saw their data affected in a breach of some kind. In the last quarter of 2021 and into 2022, we saw that over a dozen hospitals, a medical manufacturing company, an EHR, a cardio practice, a gastro health clinic, had all had to notify over 4.5 million of their patients that they had been breached and that EPH had been stolen. And then we saw in a local medical practice breach that a cost of over $100,000 and a government investigation, critical services were down for 2 full days and another 8 days until they were fully restored. For that time, those thousands of patients that were affected, both with the services not being available and with their medical data being stolen or breached.
It can be crippling for
Without a doubt.
practices. That's very significant, and which brings us to why we're even here today. We've introduced a new approach to our security risk assessment to help address some of the changes that are happening in this industry. So Mary, I want you to jump in here. PEAKE is not new to offering security risk assessments. We do this all the time. In fact, if you're a PEAKE client, a part of our Practice Advantage, it's something that we do often. We also offer a security risk assessment and have as a third-party option. If you already have a IT solution, someone else is managing it, we come in and help and assist and provide a security risk assessment to supplement what you already have. So here's the question. Why is PEAKE adjusting our security risk assessment? Why change it now?
Yeah, I understand. Yeah, we have been doing this for some time. Many SRAs that are conducted are designed to fulfill a requirement, which is to conduct a risk assessment. And that can be done easily through a website, checking boxes, or an online tool. But based on our experience, a more strategic approach for healthcare environments is needed. And, at PEAKE, we're really not interested in just getting by with the minimums. We want to offer medical practice leaders a way to truly protect their practice from cyber attacks and the crippling repercussions that come with that. As an organization that is entrenched in healthcare IT, we understand the pressures and the demands on growing medical practices, and our mission is to allow those medical professionals to do what they do best by doing what we do best, which is securely managing IT environments.
Yeah, so Elisabeth gave examples just a moment ago of how much this cyber attack could really affect a practice. And so what I'm hearing you say is this: we don't want to just check off the boxes. We don't want to stay in shallow. We want to make sure we're doing everything we can to truly protect your practice, or at the very least mitigate some of the effects or impact that a cyber attack can have on your practice and your patients. And so that leads us to learn more about our security risk assessment offering. What is different about PEAKE Security Risk Assessment? So we're calling this our Healthcare SRA. And we have two options that it could be interacted with or engaged. We have what we're calling a compliance SRA, which gives you additional analysis, more than the checkbox, just further insight into your technology and where vulnerabilities could be, and allows you to prioritize what should be addressed to help shore up your practice. And then we have what we call our Max SRA, which includes our full recommendations. Turn in every corner, doing everything, and we're going to get into those details in just a little bit, but that is a more robust, full scope evaluation of your practice, along with resources, security resources to help you, along with a remediation plan to help you navigate to the next steps to make sure that you're truly protecting your practice. Okay, so enough for me. Elisabeth, I'd love for you to kind of dive in and help us understand more what's included in these packages. What can our listeners expect to get if they engage in PEAKE for a healthcare SRA?
Thank you for introducing it, because we're very proud of it, and we've worked really hard to get this into this generation and to provide as much proactive behavior in it as possible. So we have a new HIPAA compliance assessment that is a PEAKE proprietary tool that we use to evaluate every aspect of the practice's HIPAA compliance posture. The HCA provides insight into the areas of technical and data security, and if you don't currently meet the HIPAA compliance standards, this is the right way to see that. It makes it very visible, and we know exactly what to move forward with. We also provide with this proofing documentation, and you can take that with you for attestations or insurance purposes that, like network scans, really prove that you are having compliance implementation. And then, like you said, we've got our Max, which of course we're very proud of, we're very happy with. And it is really a comprehensive full set of modules that add to the HCA, the HIPAA compliance assessment that I just talked about, by adding in granular analysis of vulnerability scans, proactive evaluation of the implementation of technology procedures, live employee cybersecurity training, which I'm very excited about personally, email phishing training, written policy support to ensure that the practices have all of the policies that they need to be in line with HIPAA compliance, Physical audits to ensure that the physical security of the network and the EPHI is accessed properly. Testing and verification of a practice's data backup, which, as we know, is critical. We need to make sure that the integrity and the availability of your backup solution is tested and it's proven in case of a need to restore. And an action plan of recommended remediation steps, something you talked about just a moment ago, to help the practice reach beyond just mere compliance. We want to get you a step further.
Yeah,
Absolutely.
and the great thing about PEAKE is we have the resources needed to assist with the remediation effort, because that can be a lot.
Yes.
Yeah, we believe that this new security risk assessment offering is going to help further secure and scale your practice. We feel like this is something that's going to be a great value to your organization. If you're interested in learning more, if you want to know more about PEAKE Healthcare SRA, you can call us anytime at 866-35-PEAKE, or you can visit our website at peaktechnology.com/SRA. And there's more information there for you to partake. And you could also request a conversation with one of our PEAKE practice advisors. This is the first step in acquiring that PEAKE Healthcare SRA. You'll have a conversation, a free consultation to kind of understand better your priorities, which package is right for you, and then schedule the implementation of that SRA, along with an introduction to one of our PEAKE Healthcare cyber security experts. We have a wonderful team. You'll get introduced to somebody who helped guide you along that process. And we want to make it as easy as possible for your organization to give you that confidence that you need to secure your practice. Yeah. We're happy to help. This is what PEAKE is all about. We're driven to help our clients seamlessly grow their practice and care for more patients. And so I would want to thank you again for joining in for this conversation, introducing our new products, this security risk assessment. I want to thank Elisabeth and Mary for joining in and helping us better understand that. Thank you. We look forward to working with you soon.